Thank you, Cancorda. I'll go first on it. Thank you, Cancorda. I want to welcome Joan Collins' motion on the National Drug Strategy today. It's certainly an issue which has taken a back seat under Fine Gael, and certainly since the recessionary cuts were made and have not yet recovered. There have been no increases in funding since 2015, despite global opium trade increasing by 65% from 2016 to 2017, the highest estimate ever recorded. Cocaine manufacturing went up 56% during 2013 to 2016, which is also the highest level in the year 2016, and Europe's early warning system monitored 670 new psychoactive substances on the market by the end of 2017, up from 300 in 2013. So it's evident that the illegal drugs industry is creatively expanding its products to expand its reach. They are exploiting the funding gap created by the government's like this across Europe, which slashed funding during the recession, creating a vacuum by which the drug trade can slip in. Now they can smuggle in an entire range of synthetic drugs to add to that. While drugs are a huge problem globally, I do want to focus on something which greatly affects my constituency and which is more of an issue than drugs in my constituency of Donegal, and that is alcohol abuse. According to the North West Drug and Alcohol Task Force, alcohol remains the primary drug of choice, while the secondary drug of choice is cannabis. In their 2017 annual report, some startling figures revealed the reality of alcohol addiction in Donegal. Out of 1,202 people referred for treatment, 860 of those were for alcohol, while 258 were for drugs. Out of a total of 1,202 people, 749 were male and 439 were female. The numbers are steadily increasing. In 2016, 691 people were admitted due to alcohol, while 593 were male and 319 women. And in 2015, 767 were admitted for alcohol addiction in the North West. I am aware of the great work of the North West Drug and Alcohol Task Force has been doing in Donegal in particular. They do so much, and yet they have the second smallest budget in the country. Only the West has a smaller budget, and if you look at the geographical area that the North West Task Force has to cover, it really is quite astonishing. Yet with the funding that they do get, they fund an aftercare worker and aftercare groups across Donegal. Their funding is also used to strengthen family programme for young people, children and families, and this is done through the Alcohol Forum. The North West Task Force also funds a youth drug and alcohol worker through Foróige and a training and development officer through the Donegal ETB, delivering drug and alcohol training and education. I am also aware that the new national strategy does have a strong element of family involvement and family support in the treatment of alcohol addiction. As a result, the task force, working with a number of stakeholders and the Minister of State, will be hosting the launch of the Community Alcohol Action Plan for Letterkenny at the end of this month, which is a multidisciplinary initiative and the first of its kind in Donegal. It is a collaboration between the County Council, the Alcohol Forum, youth groups and LYIT, and I hope that it goes far in the area of education, preventing and offering family supports. I think the National Drug Strategy, as well as government funding, needs to look at more collaborative efforts taking place across the country and should reflect the need out there for more of these types of initiatives. And the Community Alcohol Action Plan for Letterkenny is an example. I understand a family support worker has been funded for South Donegal and North Leitrim to help bolster family supports in the area. So I think we can safely say that the North West Task Force has done a huge amount, with so little being offered by this government, but more could be done. For example, if funding was provided to support the Bill W Club in Donegal Town, which supports adults in recovery from alcohol, it would help and deal with that issue as well. And I've met with them a number of times and tried to help to get them funding, but it's hard for them to get support because of the limited funding that's provided to the Alcohol Forum in the North West, because that is the only forum and the only way that funding can be accessed by any group. But one more other aspect which will need more focus is the rise of hidden harm. The experience of children living with and affected by parental substance misuse has become known as hidden harm because these children are often unknown to services. Task forces do their best to offer treatment to those who present themselves for help. However, we don't know about those who are not presenting themselves for treatment. It's also an area which is very hard to monitor, but will have major repercussions going forward into the future for children, mental health and physical health. I am aware that this motion will do much to address the situation facing Dublin and city centres and urban areas, and less to do with the situation in rural constituencies like Donegal, but that's not to say that the same thing couldn't happen, and funding will need to increase to maintain a focus on early warning and emerging trend and monitoring mechanisms. And lastly, I want to commend the hard work carried out by the North West Drug and Alcohol Task Force and local community groups like the Bill W Club, which do so much on so little. Yet their incredible work should not be taken for granted by this or any government. Thank you.